I'm glad to have you back on the morning show here on Arise News channel. I am Ndi Amogo. Our second guest of the day is an American-trained board-certified consultant pediatrician with over 25 years' experience practicing in the United States. She is the clinical director of Health Core Limited, producer of the groundbreaking TV health program, The Health Zone, as well as the editor of the accompanying Health Zone blog. Her passion for children and youth is evident in all of her professional life, and here to share more on her passions and her recent work on maternal health in Kano State is Dr. Chike-Obi. All right, glad to have you.
It's a pleasure to be
on the
back
morning
again.
show. You were here with me last week.
That's correct, yes.
Last week.
I was.
We had quite an interesting talk.
Yes.
And we talked about the program coming up this month, between the 6th and 10th.
Yes.
Which, of course, did come up.
Yes.
In Kano State.
Yes.
You want to tell us about it?
Okay, so our organization is called Health Core Limited, and our flagship product is the Health Zone, which is a health television program. And so what we did was we collaborated with the Isawali Empowerment Initiative, which is an NGO based in Kano and does all their work in the northern part of the country. We collaborated with them to commemorate the National Maternal, Newborn and Child Health Week, which held this past week. And what we really wanted to focus on this year was on malnutrition, because as you know, the United Nations has said that malnutrition is the silent crisis in Nigeria. And in the north alone, about 2.4 million are malnourished. So our goal was to go out into the rural areas and meet with women and children and do two things. One, the first thing that we wanted to do was to educate the mothers, the women, around the fact that there is a critical 1,000 days in every child's life, from the moment the mother conceives until the child's second birthday. That's 1,000 days. And over this 1,000 days, malnutrition or undernutrition in that critical 1,000 days does lasting damage to the child, damage that the child will feel the consequences of for the entirety of their lives. And so our goal was to educate the mothers on that. And secondly, to talk to them, to teach them about local nutritional sources, highly nutritional food sources that they can source locally. And so to that end, we had a company called Nurture All Foods, who's actually doing some incredible stuff around taking peanuts and millet and soybeans, which are all grown locally, mixing them together into almost like a cereal, and you make it like they make the traditional akamu or pap that people make in the morning, and you make it like that, but the nutrition content is way up because of the combination of these three things. And so we taught the women how to make that so that they can feed themselves and feed the child, because obviously the critical 1,000 days starts before the mother gets pregnant. If she's undernourished or malnourished herself, the baby she has will be undernourished or malnourished. So that was our focus with the mothers. We also did health screenings on them, you know, check them for complications of pregnancy. Most of them were pregnant women. And so we were checking them for high blood pressure, checking them for diabetes. We also did malaria screens. These are some of the three things: infection, gestational diabetes, hypertension, that actually create problems and keep our maternal indices really, really low for sub-Saharan Africa, why women die in pregnancy. And so this is what we did. We also were very, very fortunate to have the Society for Family Health. They sent a team out to screen these women for HIV, counsel them, and in the event that they picked up some of them who had STIs, sexually transmitted infections, actually treat them. The women that we found who had malaria, we treated as well. And then for the children, this was the fun part for me as a pediatrician, was what we did with the children was we screened them for malnutrition and for stunting. Stunting is delayed growth of the body and the brain as a result of malnutrition in the critical 1,000 days. So we weighed the children, took their height, and did what's called a mid-upper arm circumference. You take a special tape and you pass it around the child's arm, and you see how, thick the child's arm is, and that will give you an idea of the child's nutrition. So we did that, and then we gave the children vitamin A, which is a micronutrient, a powerful supplement that's good for eye health. It helps prevent childhood blindness, which is very prevalent in sub-Saharan Africa. Okay. It also helps them with their immune system. It helps them with the intestinal tract, with their skin, so it just helps them grow and fight infection better. So we gave them all vitamin A micronutrients, and we also gave them deworming, because as you know, worms actually take up your nutrition. So a child may be getting fairly adequate food, but if they have worm infestation, the worms are taking up the nutrition that the child's supposed to have, and so the child will remain undernourished. So we dewormed the children. And what was fascinating to me and very, very sad was two things. The turnout was massive. In fact, on the second day, in Rano local government, we had to close the doors because the primary health care facility we were using was
busting
overflowing.
At the seams.
Absolutely. We couldn't take any more women and children. And at this point, we were probably close to 300 women and children in a small primary health care facility. So that was heartbreaking for me. And the other thing that was heartbreaking was that in the first facility on Wednesday, 15% of the children were malnourished. In 15%. The second facility, 25%, so 1 out of every 4 children in the second facility was malnourished. And you just, we have some footage that's showing right now, some of the things that we did. This is us doing the screening for the women. Like I said, we did malaria testing, blood sugar, we tested them, their blood pressure, we weighed them, and then we had the HIV screening section run by the Society for Family Health. The children were, you can see we weighed them. That's the vitamin A supplement that we gave the children. That's me giving a child vitamin A supplement. Okay. There. That's me in the red glasses. That was me. What was really, that's the deworming medication that I'm about to give a child. So if the child was 3 and above and could chew it, we gave it to them directly. If they couldn't, we crushed it and we poured it into their mouths. That's me pouring crushed deworming medicine into a baby's mouth. That child is not happy with me, and we chase it with a little water. Very unhappy with me.
To put it.
Yeah, and again, some more of the screening that we did on the women.
My heart is also touched, when you talked about the people who couldn't gain entrance. Yes. Did you do afterwards? Was anything done for them?
Well, what we actually did afterwards was we had gift bags for each woman, which contained this Nurture All Foods, the food supplements I talked about. It contained hand sanitizers, soap. It contained mosquito coils, again, because we were trying to get them to focus on malaria. So what we did is the women that we couldn't actually screen, we gave them the bags. We gave them these bags to go away with, so at least they didn't leave empty-handed.
Well, at least that will get some for them. What feedback generally did you get, and have you been guessing since?
Well, we just returned from Kano yesterday, so we're still in the process. In fact, the Society for Family Health is sending us data around the HIV testing they did. So we begin to get a sense of what percentage of the women were HIV positive and that sort of thing. But for me, the key thing is really the follow-up, the monitoring. What do we do? I told you, in one facility, 15% of the children were malnourished, in another 1 in 4, 25%. So what we've done with our partners in Kano, the Isawali Empowerment Initiative, is set up a system where this Nurture All Foods will supply us this PAP-like thing, that had this food fortifier in a way that's been made. And we will give these children on a monthly basis. So we'll give them 1 month's supply. and they come back, we weigh them, do their mid-arms. You know, we will monitor the children that we have picked up as being malnourished. We took as much information, as much data as we could on the children, because a lot of the women don't have phones. So we know that the villages they're in, we know who the village head is, who the ward head is, so we can track them that way. We get them to come back to that primary health facility. They're all coming back on Thursday to their respective primary health facilities this coming Thursday to receive the micronutrient, the PAP, the nurture of foods. It's called soy kunu. I have to give, and the woman who made this, Dr. Rahama Funshaw, amazing woman. We got a chance to tour a little factory there.
Is it oh, yeah, because I was going to ask that.
Yes.
Is it packaged? Like,
yeah,
it's
packaged. I wish I thought to bring one with me. Yes, it's a little package, 100 grams of this mixture of roasted peanut, millet, and soybean. And you know, soybean is high in protein.
Did you get in contact with her, or was she making it? And what
she did was somebody knew her, told her about what we were doing, and she donated cartons of this nurture of the soy kunu for us to use during the two events to give to the women. So that's how come we were able to put them in each bag, each gift bag the women got. So she was the one that she's actually supplying IDP camps now. The day we arrived, they were halfway through supplying 20 tons of those packets to IDP camps in Maiduguri, because it's highly nutritious and helps turn around malnutrition very quickly because of the contents of that.
All right. This particular program, the Maternal child care,
health, newborn and child
health. This has just happened in November.
Yes.
Is it a monthly thing? Is it a yearly thing?
Okay, it's a National Health Week that is biannual. Yeah. So it's held usually in May and also in November. And the point is to heighten awareness around maternal, newborn, and child health throughout the country during those times.
For you being a pediatrician,
yes,
and with what you know, and maternal mortality and all that, we did discuss about all this. You're doing well, but biannual, is it for starters? Is it enough? Is it? Do you intend increasing it?
Well, this is a National Maternal, Newborn, and Child Health Week, so determining that it's a biannual event is based on the Nigerian Ministry of Health. It is something that the United Nations and the WHO, they have both bodies have recommended it to all countries to at least have once a year where there's a concentrated focus on these issues, maternal, newborn, and child health. The idea is that work is going on throughout the year. Yeah. These are just 2 weeks that are picked out of the year by the Federal Ministry of Health to highlight, to make the rest of us, the rest of the country, the rest of the world understand that these are the issues that we have, and these are the things that we're doing to address those issues in these areas.
Well, that's quite interesting. For you, what would you say is the state of healthcare generally in Nigeria as of today?
I would have to say two things. For the individual citizen, there is poor health awareness, poor health knowledge, poor health literacy. And so that affects our understanding of health. It affects our health-seeking behavior. When we are ill, what do we do about it? Where do we go for help? Do we even know we're ill? Do we think this is urgent? Do we think it's time to seek health care? All of those are driven in part by our understanding of health. So if our health literacy is low, health awareness on general basic things like malaria and diarrhea is low, it impacts how we seek health. So that's for the private person. And for that person also, there's limited access to quality health care across the board. Obviously, in urban areas, it's slightly better. It's not perfect. It's far from perfect, but it's worse in the rural areas. The second part of the answer to your question is on the side of the health system. We have a very weak health system. We have close to 180 million people and less than 100,000, some people say 35,000 doctors throughout the country who are working for the government. Everybody is in, most of the health in this country is driven by the private sector, not the federal hospital or the general hospital or the primary health care center. We have primary health centers all over the country, but they're poorly staffed, poorly outfitted, and poorly supplied. So that then impacts the access the person in the rural area or the person in the urban area has to seek health care. The facility, one of the facilities that we were in 2 days ago did not have a working blood pressure machine. So if a healthcare facility does not have a blood pressure machine, that means everybody that health center services who has any problems with blood pressure is on their own, whether they're pregnant or they're male or non-pregnant females. There is no way to check that. It's called a vital statistic in health, blood pressure. Yeah. It's taking your blood pressure, your temperature, your weight. Vital health statistics. These are what we call, and we can't even do that. We can't take that vital sign of blood pressure in a facility. So yes, our health system is in shambles.
What should we be doing?
I don't know that I'm the person who should be prescribing what we should be doing.
Well, why not
this.
if not? I mean, they are listening and you can give ideas.
Okay.
You never know where the ideas could drop and who could pick it up.
All right. The first thing we have to do as a nation is we have to own that our most valuable resource for Nigeria is the 180 million people that we have. And so it is vital that we educate them and we keep them healthy. Those are the engines that will allow Nigeria as a nation to be anything in the 21st or 22nd century. So once we understand that this is our most vital asset, is the human capacity, the people that we have, and we begin to focus on their health. The World Health Organizations have said primary health care is the way to go. It is the way that the rural woman can access health care because there's a primary health center in her facility. Let us outfit those so that they are providing basic health care. I can talk about this forever.
Forever. You and I know the place of SMEs.
Yes.
In growing an economy of a nation.
Yes.
What's the place of primary health centers? Because I think I've heard say that we need so much of that in places like the rural areas and stuff. What's the place of that?
Okay.
Yeah, you know.
A small and medium enterprise needs people. It needs, if it's, for example, the factory that we went to that makes this Nurture All Foods, it had maybe, at least that we could see, maybe about 20 employees. So that's considered an SME, right? Those employees need to be healthy to be able to come to work on a daily basis, to earn a living for themselves and to make that business successful. If they are dealing with malaria and dealing with undernutrition and simple things, gastrointestinal illnesses that prevent them from coming to work, it directly impacts their livelihood and directly impacts the success of that SME. And so it goes back to, if our people are healthy, then they can be productive. If they are productive and educated and skilled, then they can truly contribute to making a vital and robust economy that is not dependent on one commodity, oil.
Oil. All right. We'll take a break. I'll get back to you. We'll talk about the cancer awareness. Well, the cancer.
We just had Breast Cancer Awareness Month.
Awareness Month in October. So we'll talk about it. It's time now for another a short break. I'll ask you to just still stay with us on The Morning Show. We'll be back.
The best way to predict the future is to create it. There's a special breed of achievers out there that are called tomorrow's people, the highly creative ones who live in the future. They imagine what will be and strive to make it happen. They're bold. They refuse to wait for the future. Tomorrow bends and conforms to their ideas. At Access Bank, we share the same sentiments. We've been able to grow our bank to become a leading player in Nigeria with a strong presence across the continent, adopting best practice in everything we do. Our mantra for success is simple: speed, service, and security. Those who shape tomorrow, strive for, and demand perfection. At Access Bank, our service culture of speedy response and drive for excellence is the blueprint for creating customer experiences that will echo for generations. Come, let's work together and take tomorrow.
It's been a great year for agribusiness. With our weather and the amazing range of soil available to us, the fallow lands are birthing their magnificent potential. The Central Bank of Nigeria, under President Buhari's administration, is spearheading this progress, and everyone is getting in on it. The local farmer on the Anchor Borrowers Program and the international investors, taking advantage of the new policies geared towards easy foreign investment, stabilized exchange rate, and FX market. The harvest is green and lush, and we are just getting started. Come, invest in Nigeria. Discover what the green in our flag really stands for. Nigeria, ready for business. An initiative of Greenfield Assets Limited.
It's still The Morning Show here on the Arise News channel with me, Ndi Amug, and I still have Dr. Toju Chike-Obi. I mean, anybody who hears Chike-Obi knows the mathematician, but this is not about maths, this is about health. In October, just ended, it was a breast awareness month. What was the awareness really all about? I mean, what did it involve?
October is Breast Cancer Awareness Month, and it is a month that's been set aside for what I just said, to make people aware of breast cancer, aware of what causes it, what you can do to detect it early, because that's the key, and what you can do to prevent it, and to educate people on what's available to them in all of those areas. And so the world over, the current statistic, the current data shows that about 1 in 8 women will develop breast cancer in their lifetime. And so in sub-Saharan Africa, traditionally, we have not seen the same sort of cancer rates across the board as more developed countries. However, we are beginning to see in the last 20 years, there's been a doubling in the rates of breast cancer and other cancers across the board in sub-Saharan Africa. Part of that is driven by greater awareness, of course, but mostly it's driven by the change in the societies. As African nations are becoming more socioeconomically developed, they are, of course, having more access to some of the Western things that we know in the West are bad for us, but we think in sub-Saharan Africa, having access to that means we have arrived.
You don't want to mention
So,
that.
I mean, things like food, cigarette smoking, alcohol consumption. So these are all things that are drivers of the increase in non-communicable diseases in sub-Saharan Africa. We used to deal with the communicable ones, the malarias and the onchocerciasis and stuff like that. Now we're beginning to we have a double burden now, where we're dealing not only with communicable diseases, but non-communicable diseases such as breast cancer. And our issue regarding breast cancer here in sub-Saharan Africa is that the women who develop breast cancer here come late in the course of diagnosis. So at the point where they're diagnosed, it's usually late in the disease. And obviously that impacts the outcomes because with any kind of cancer, early detection is the key.
Let's take it from there. What should I be doing to early detect it before it gets late?
Okay. There's some things that first you need to understand about breast cancer. Every cell in the human body has a lifespan. And nature has created something that cells turn themselves off or kill themselves, so to speak, when the time is right. In cancer, something has gone off in that natural mechanism. And so that cell, instead of turning itself off, it continues to grow. And in growing and multiplying, it begins to impact the normal cells around it. And that's really, in essence, what cancer is. It's cells that are growing abnormally, and there's nothing the person's own body and immune system can do to shut off that growth. And so it impacts the other organs, the other surrounding tissues. And then when bits of those cells break off and travel to other parts of the body, then that's when the cancer spreads. So that's really what any cancer is. Now, when you say breast cancer, this whole process I just described is happening in the breast. So you can imagine this isn't a process that just starts and boom. It's a gradual thing. The cells grow and grow and grow and grow, and then they start to impact the other cells around them. They start to take up all the nutrients of the other cells around them. Then the rest of the body starts to suffer, and then they break off and go other places and grow in those places. This is a process that takes a while. And so early detection is key because for breast cancer, if you find it early, then the treatment that we have available can kill off those cancer cells and, in essence, cure the person of the cancer. However, if the cancer has progressed and is in a more advanced stage, then it's harder because now it's probably traveled to other parts, to lymph nodes, to the bones, to maybe the lungs, maybe to, it's traveled to other parts. So now the work of trying to contain this is almost impossible. And so that's really what we talk about when we talk about early detection is key in any kind of cancer, and particularly in breast cancer. Breast cancer is the second most common, is the most commonly diagnosed cancer in sub-Saharan Africa, but it's second to cervical cancer as the cause of death. So it's the most commonly diagnosed, but it's the number 2 cause of death. In
second
cancer death. Yes, second to cervical cancer. And unfortunately, African women, and it's part of a lot of the research that's going on, we tend to have breast cancer a little bit earlier than the average women of other races. And we also tend to have a slightly more aggressive form is very common when you get it younger than for other races as well. And so for those reasons, it is imperative, it is really, really important that we detect breast cancer early. And there are screening tools that we can use. And that's I guess that's going to be my main message today, is that women need to screen. There's several organizations. There's the American Cancer Society. There's the United States Prevention Committee on Cancers that have come up with guidelines as to when women should be screened.
How accessible are these screening places to the women? I'm not just talking about people, I don't know what to say, people who can afford it. How accessible, how cost efficient for them are these screening places?
Okay. The main screening tool for breast cancer is a mammogram. And a mammogram is really just a specialized X-ray of the breast. That's all it is. Many many radiology centers in major hospitals, in, for example, a general hospital or in a teaching hospital or in the larger private health facilities, should have the means to do mammograms. Mammograms are recommended for women 40 and above, to have yearly mammograms, 40 and above. And so you should be able to go to your general hospital. It won't be in a primary health care facility. You're unlikely to get that. In fact, I know you don't get that in Nigeria. But you should be able to get it at a general hospital and in a tertiary hospital, which is like your teaching hospitals. And again, like I said, in the private health facilities. If you do it at a general hospital, I believe you can get a mammogram at a place like a general hospital for the equivalent of about 2,000 naira. In some of the private health facilities, it can, depending on where the facility is, it can go from there to perhaps as high as maybe 10,000 naira for a mammogram. But it is recommended that every woman gets screened. It should be something that the federal government is doing routinely for screening to help prevent and make people more aware of the issue of breast cancer. However, we don't have a culture of preventive health in Nigeria or in sub-Saharan Africa. Our culture is curative health. So after you get ill, then you go and seek care for the illness, as opposed to going to get yourself checked on an annual basis or every other year to make sure that if you are beginning to develop, say, hypertension or diabetes or breast cancer, that it is detected early.
When you say we have a culture of curative and not preventive, are you saying that, I'm trying to understand that.
Yes.
Are you saying that we're more likely not to want to go for checkups, but then when disease or sickness strikes, we'll go for
Yes,
cure?
that's exactly what I'm saying. We have a culture where it is when you get ill that you seek health care. You don't think, well, let me just go get checked just to make sure I'm not getting ill or there isn't something that's about to start or started that I can nip in the bud in the early stages. We don't have a culture like that. Part of it is obviously because of the imbalance between the numbers of people that we have and the numbers of healthcare providers, health workers that will provide services for those people. That's part of it. But largely it is also cultural.
Culture thing.
You know, it's also cultural. And so that is what somebody like me and other colleagues of mine are trying to make that, to re-educate people around that. That's what we do with our organization, the Health Zone. Don't wait until you get ill. With everything that we do, if we're talking about malaria, if we're talking about breast cancer, we always talk about what can you do to prevent it. And one of the things that you can do to prevent it, in addition to getting checked, is also lifestyle changes, which is very critical for breast cancer, because a lot of the research that's coming out now is clearly linking obesity and alcohol consumption to breast cancer. And so if you're aware of that, if you know some of the drivers, the risk, what are the things that put you at risk for breast cancer are, for example, obviously being female. Just being female alone puts you at risk for breast cancer. And then if a woman that's over 40, particularly over 50, is at higher risk for breast cancer. If you have a family history of breast cancer, you're at higher risk. If you have a genetic predisposition to breast cancer, meaning you've had a genetic testing that shows you have the breast cancer gene, then you're more at risk. If you are overweight, if you consume a lot of alcohol, if you have another thing that the research is showing is limited physical activity, if you don't exercise, that also increases your risk for breast cancer.
These categories of people should be doing checkups.
Yes.
That's what you're saying.
Everybody should be.
Everybody, I know, but specifically. Everybody should be, but specifically. Thank you so much, Dr. Toju, Chike-Obi, for being here again on the morning show.
It's a pleasure, always.
All right. It's time now for another break. Stay with us for more on The Morning Show.